In response to COVID-19, PSP is offering virtual fitness to Canadian Armed Forces members. By using social media platforms, the virtual fitness classes tailored to Canadian Armed Forces personnel become accessible to all. Participants who are not Canadian Armed Forces members recognize and acknowledge that their age, health status, and physical fitness level are unknown, and it is entirely up to each individual to assess how they're able to participate in this class. Since it is preferable to consult your physician before beginning any exercise program, we invite all participants who are not Canadian Armed Forces members to consult the Get Active questionnaire of the Canadian Society of Exercise Physiology and its reference document. If you experience any pain or difficulty during the exercises presented in this video, it is recommended that you stop and consult your healthcare provider. If CAF members sustain an injury during this video, please remember to fill out a CF98. My name's Deva Carr, and I'm here to talk to you from CFB Halifax about inversions, one of my favorite passions in fitness, getting upside down, giving yourself a challenge and a new perspective. Thanks for joining me. If you look online, you'll find lots of resources about the benefits of inversion therapy. Physiotherapists have been using things like inversion tables and gravity boots to help people decompress their spines and reduce pain. But the benefits of inversion training go a little bit further. Not only are you experiencing decompression of the spine as your body is upside down and in a direction that it's not necessarily used to having a load, but it's also providing a chance for dynamic balance and stability to be affected through your entire body, as well as the neurological benefits of having this new sensation of being upside down, the challenge that it presents to your balance through your inner ear because you are used to being right side up, gives you all kinds of new sensations and new progressive challenges. So today we will be looking at exercises to help you get used to the feeling of being upside down before you step up to the big challenges of our big 4 inversions. Other benefits include the way our blood vessels, our veins, have valves that prevent backflow. When we go upside down, it allows stale blood that has become trapped in our lower extremities to return to the heart for reducing the amount of carbon dioxide that's been circulating through the lower extremities and improving oxygen flow, not just throughout those legs, arms, and below the hips, but also by promoting blood flow through the brain. And at first, this will seem overwhelming. A lot of extra blood to your brain may make you dizzy, may have you seeing some spots when you return right side up, but don't be afraid. That's normal. Take it in progressive steps, a few seconds at a time, and increasing as you become more comfortable. As I mentioned, some of these challenges will be scary. It'll be daunting the first couple of times that you put your heart above your head, so take it slow. Some other challenges, like I mentioned, your inner ear, will take getting used to this change in balance. But some studies have shown that your focus, concentration, and overall sense of well-being can be improved by allowing your body to become comfortable with these uncomfortable situations of rotating through your head, through your body, and through your spine. There will be some flexibility requirements that may pose a challenge to you beginning inversion training. If you are particularly tense through your back, through your spine, and through your hips, then there will be difficulties, and that's why the most important thing that I want you to take away from this workshop is that there are always progressions if you are interested in this type of training. I have here your basic 4 progressions towards inversion training. So inversion training doesn't necessarily mean that you're going to kick right into a handstand right away. As mentioned, hips above heart and heart above head are going to give you most of the benefits for your organs, for your balance, and for your stability. So here I've written, we've got our bridge, which can be simple exercises like the glute bridge, the marching bridge, or the supported bridge. Supporting myself on my shoulders was the first way that I learned how to get upside down. Once you have this base of support through your bridge training, you will learn that you are able to lift your legs above your head with the support of your hands on your back and your shoulders. This is called a shoulder stand and can be used to develop back strength and the cardiovascular capacity to sustain yourself in this inverted position for longer periods of time. I recommend starting here. Once you are comfortable with a shoulder stand, then I recommend you take your steps next to our downward facing dog positions. This gives you a chance to strengthen your upper body, your shoulders, and progress even further. Once you're comfortable in a downward dog position with your arms next to your ears, then you can begin to add load and strengthen up your core. That brings us to teddy bears and dolphin planks. So we've got four major lifts, four major inversions: the shoulder stand, the headstand, the handstand, and the forearm stand, being the most difficult because of the increased challenge of balance on a shortened lever. So now I'd like to get into developing some of these exercises and progressions so that you can start inversion training. As I mentioned, bridging and shoulder standing are your introductory components of any inversion practice. So I would like to demonstrate for you some of the progressions for the shoulder stand and the bridge. You'll begin by laying down on your back, creating a contact point with the back of your head and your shoulder blades. The closer your shoulder blades can retract together, the more strength you'll bring into the floor and your base of support. Lift your hips up in the air, bringing your chest up towards your chin and lifting your chin by pressing the back of your head into the floor. From here, you can either grab onto an exercise mat if you have one at hand, walk your shoulders even closer together, or maybe even clasp your hands behind your back, again providing a little bit more opportunity for squeezing the shoulder blades together. Once you're comfortable here with your heart above your head, you will be able to press through your feet, squeeze your glutes together, and lift one foot off the ground. Challenge yourself further by beginning to extend the leg right up into the air and reaching your toes towards the ceiling. Alternating sides allows you to march this practice and even come down, pressing back up with one foot, coming down with the hips, and repeating on alternating side to strengthen the shoulders, arm pressing muscles, and core strength to lift your hips higher in the air. Take breaks as you need, because this will challenge your cardiovascular strength. You may already be breathing heavy just by holding a glute bridge for 30 seconds. Once you have that base of support through an extended arm on the floor and you feel you're strong and ready to lift both feet up, we'll need to change our action and base of support to provide a little bit more leverage to lift the weight of your entire body onto your shoulders. Resume the position on your shoulders, lift your hips in the air, and this time, instead of clasping your hands, place your hands across the small of your back. Finding the hip bone at first, repeat marching to get used to the sensation of weight on your shoulders and now your hands as well. Once you have enough weight and support in your elbows, you can lift both feet up, and this is your beginner shoulder stand. You have this base of support, you have added support, and then to perfect this movement, we're looking to increase the verticality of the hips over the head. Remember to take lots of breaks so that too much blood doesn't rush to your brain and cause you to become lightheaded, dizzy, or faint. Deep breaths during your rest periods will help you to expel that extra oxygen that's flowing out of your legs back to your lungs, through your heart, and replace it with oxygen so that you stay ready and able to continue your practice. Now I'll demonstrate a shoulder stand with support from my low back from my hands, at which point I'll take my hands off of my low back and begin extending them in the same manner we used for our initial glute bridge. So, retracting the shoulder blades, lifting the hips, support your back. Now, walking the feet tippy toe closer to your shoulders will start to let you climb your hands up your back, so you're no longer holding on to the hips, but lifting higher up your spine. Practice 1 foot at a time, and when 1 foot is in the air, you can press your back and find your balance. Walking your hands even further up your back, letting your shirt fall if it's not tucked in, and letting your legs kind of counterbalance if you choose to extend your arms. From there, we can practice lifting the legs up, tucking the knees in one at a time to strengthen the core, or tucking both knees and extending up. Slowly release one vertebra at a time to come down gently without a thud on the floor, at which point you can right your body head over heart, take a few more deep breaths. Once you feel comfortable with your supported and unsupported shoulder stands, then you can start to strengthen the arms and the rest of your core musculature that helps you support the weight of your body when your feet are directly above your head. The shoulder stand offers you a progression that doesn't quite put you completely upside down in that vertical axis. So do take your time progressing and warming up with shoulder stands before you step into your handstand and headstand progressions. For handstand progressions, which I do recommend before attempting headstanding, you'll start by finding a downward facing dog position. So hands a little bit wider than shoulder width apart, and then begin to stretch your body out up to the hips to create one long line from hands to hips, lifting the tailbone and lifting 1 foot at a time. I do recommend doing so against a wall because it does offer you the opportunity to find support for that extra weight so that it's not all immediately coming down on your upper body, on your arms. Another way to do this is to use a support object like a chair or a box or even a step. Maybe you have stairs at home that you can gradually increase the height of your feet. So I'll provide a little bit of a demonstration here, just using a simple chair, a low chair, using exactly the same hand position, spreading out your fingers, and beginning by putting 1 foot up on the chair. And from here, lifting your head between your arms. This begins to bring more of your weight over your base of support in your hands. And again, just like with the glute bridge, practice adding more load by lifting 1 foot at a time. And maybe walking your feet, or your hands, closer to your feet until you reach your legs so high in the air that the other foot begins to lift off of the chair. Once you're comfortable with this pike position, you're welcome to begin moving your hands left to right, in and out, pressing and feeling the weight of your full body or more of your body on your arms. With your arms strengthening in this manner day by day, you will be able to begin bringing your practice up to the wall. Now this is the big step that most people think of when we start handstand practice. So don't rush it, it is scary. But with these progressions in mind, and with the practice you've already done, from the floor to the chair to the downward dog position, with that foot on the wall, you can begin to walk your hands in. Maybe lifting 2 feet up to the wall and pushing your head through your arms. At which point, walking your hands closer or your feet lower will give you more of that pike position, 90 degrees at the hip. And as you become prepared, you can walk your hands closer and closer to the wall until your full body is against the wall and your nose will touch. Walking down gently and bringing your knees tucked into your chest will help you from falling down on the floor. Now, walking up and walking down will give you a lot of the upper body strength and the core stability to begin working towards the kick up that we often see with athletes training handstands. So if you feel safe and comfortable with an object, you can bring your chair closer to the wall to just give you that added support as you walk yourself up to the wall. I recommend being about a foot away from the wall to start. Maybe you can use that lift to find that same pike position that we practiced just with the chair, and reaching 1 foot up until you kick the wall. Once you kick the wall with 1 foot, kick the wall with both feet and reach your head through. The same way that you reached your head, your nose to the wall in your wall walk practice. And there you are. You're upside down, you found your handstand. Great job. I always recommend taking it slow, starting with the wall, getting support until you're a little comfortable with being upside down. And the next couple of progressions and inversions are more challenging. So I don't recommend rushing to these stages until you're comfortable walking yourself and kicking yourself upside down against a wall, because headstand, although it does seem easier because of the third point of contact with the ground, it does put a lot of strain on your spine, especially the tender vertebrae of the neck. So it's important to have a strong basis of foundation before putting your head directly in contact with the ground. That's why I do recommend starting with simple progressions to make sure that your strength is there, so that when you begin pulling more weight over your hands and over your neck, that you have the supporting musculature. So you'll see here I'm doing some mountain climbers, some planks with leg raises to get the stable muscles of the shoulder girdle involved in supporting you. You'll also notice that we've changed direction. We're nowhere near the wall, and we want to have some free space just in case we come down on a weird angle. We can still get our feet down. We're not worried about flattening down onto the back, but you don't want to have too many obstructions there, just in case. So we've changed directions, we're away from the wall, we're able to do planks with 3 points of contact with the ground. So that means that our hands are stable enough to bear this amount of weight. Then we can start bringing one knee in higher and higher. From here, if you can bend your elbows, that creates a stable position that's similar to where you will be once you begin to be in a headstand. So yoga is a great practice to train this ability and to reduce your fear of failure. You're not that far away from the ground for the next movements, so if you are worried about falling and you do have to fall or bail, then it shouldn't be too detrimental. You should not run into injury. So the exercise that I'm going to demonstrate is called crow. It's an arm balance, so once you're familiar with your handstand, and you can lift one knee up and bend your elbows into a push-up position in a mountain climber, then start in a low squat. Your heels don't have to be on the ground if you don't have the range of motion in your ankle to get your heels to the ground. That's not important. We're just trying to get your knees to find your triceps here. So when you start with a bent elbow position, you can look forwards, pull your bum up in the air, lift one toe off the ground, and eventually lift both toes off the ground. And at first, it may just be a little dance, taking one toe off the ground, looking forwards, and lifting both toes. The goal here is to be able to tip slowly and land down on your head. This is a falling crow action, and it's to show you that your forehead will protect you from losing your balance, and it's to help lift using your core, your hips above your head. So I'll demonstrate that one more time. Hands about shoulder width apart, knees on the triceps, and just bending forwards, finding a balance point, and then losing that balance point to get the top of your head onto the ground. From here, you're in a teddy bear stand. You can continue to lift your hips and lower the feet up and down with a little bit of strength from the hands, but mostly from the low back, and eventually extend one knee. If you're gonna lose your balance, come back down, lift the other knee, and eventually both knees will come up in the teddy bear stand. Now, the teddy bear stand is not my favorite headstand. I do feel like it still puts a lot of pressure onto the crown of your head, and that's why I prefer a traditional handstand, clasping the hands and taking the hands to the back of the head, kind of exactly where my bun is where you want to have your hands clasped. I'm going to go just below, and that way your elbows will be shoulder width apart, and you'll be more leaned on the back of your hand than on your skull. So to demonstrate, now I don't have a tricep to lean on, but I can still bring my knee towards my armpit and gradually roll legs up, finding the vertical point, engaging the abs, and coming down one foot at a time to catch myself. The major difference between these two headstands is with that traditional tripod stand, that is putting the balance across a longer lever than a teddy bear headstand, and creates the foundation to be able to lift my head out of the cradle into a forearm stand, which once you're ready for forearm stands, you may find yourself using pieces of each progression to make yourself more comfortable, balancing against the wall with your feet, walking up. The sky's the limit, whatever you feel is comfortable for you. If you're ready, if you're confident with your first 3 inversions and you'd like to take it to the last level, then again, you can always start from that plank with a leg lift, or from a tripod to get the base of support necessary to lift your head. Or, once you've mastered it and you're against the wall a few times, kicking right up and looking forwards. Selecting one point to look at is always a recommendation, whether you're balancing on one foot or on 2 hands. So take your time, use all these tips, and you can always reach me at david.carr2@forces.gc.ca if you have any further questions about inversion training for me here at CFB Halifax.